So atrial fibrillation, which is the commonest abnormal rhythm, we think originates from the veins that drain blood from the lungs into the heart, the pulmonary veins. There's abnormal electrical activity in there that triggers the AF, and if you disconnect that electrical activity from the heart, you can stop the AF occurring. And what cryoablation does is allows you to push a balloon up against the origin of the veins. You then freeze the balloon and it creates a ring of frostbitten tissue around the outside of the vein that can't conduct the electrical signals. And in that way the pulmonary vein becomes disconnected from the atria, and hopefully the trigger for the paroxysmal atrial fibrillation, which is AF that stops and starts on its own, is eliminated and the AF sorted out. One of the advantages of cryoablation is that it's a very process-driven procedure. So you're doing the same thing in the patient every single time. You push the balloon up against the veins and isolate them. That usually takes about 3 minutes for each vein. And because the procedure is very repetitive, with no requirement to create complex point-by-point lesions around the outside of the vein, which is what you have to do with radiofrequency, it's very easy to replicate both between patients and across different operators. And that means that you can then start making the process very efficient and give very reproducible and predictable outcomes. What that means is that you can then do one procedure every hour as opposed to one procedure every 3 hours, and the patients recover quickly because they tend to have less discomfort and pain and can often go home the same day. So it's a big transformation in the way that you can deliver care. And that's really important for atrial fibrillation because there is huge demand. Lots of patients have atrial fibrillation, lots of patients want ablation, and at the moment it's very difficult for healthcare systems to keep up with that demand.